The U.S. could see 1,000 deaths per day from COVID-19 this winter if the rate of booster shots doesn't improve. Here to answer questions is Dr. Paul Sachs, Clinical Director of Infectious Diseases at the Brigham. Dr. Sachs, thanks for joining us.
Thanks for reminding me.
All right, Dr. Sachs, so right now the U.S. is averaging about 400 deaths a day from COVID. So that means if this forecast holds, the rate could more than double in a matter of weeks. So why do some researchers believe more booster shots, though, might make a difference in that?
Well, we've seen already during the pandemic that booster shots reduce the severity of COVID-19, and they do so in particular in the most vulnerable populations. So I'm talking about people who are older, people who have underlying medical problems known to be associated with severe COVID. They should really go out there and get their booster as soon as they can.
Well, so Dr. Sachs, you know, the CDC authorized the updated booster shots before knowing for sure really how much protection they actually offer against the current Omicron strains. So when do you think we'll learn how well they are in fact working?
Well, what they're going to do is they're going to look at the likelihood of people developing COVID in those who had a vaccine versus those who didn't have a vaccine. And we should have some information sometime during this season to get a sense of whether these new boosters are working. I suspect they will, and I think they will because they've been tuned in particular to the Omicron variant, and we haven't had any COVID vaccines yet for Omicron, which is currently very, very widely circulating.
All right, so we're still getting a lot of questions from viewers, Dr. Sachs, about when to get that updated booster, and if you get it with the flu vaccine, whether you should get the shots in different arms. I don't mind telling you, I actually have my appointment scheduled for next Thursday. I'm getting the Moderna bivalent booster and the flu shot. So should I do one on each shoulder? What do you tell your patients?
Yeah, I'm recommending one in each shoulder. The sore arm is a very common side effect of both the COVID vaccines and the flu vaccines, and there's really no evidence at all that they would interfere with one another. If you're someone who really can't stand to have your arm out of, either arm out of commission for a while, maybe go ahead and get it in one arm, but most people should get it in both arms.
I will say I did the one arm for sleeping purposes.
Oh.
Left arm, and it was okay.
I'm fine with both arms because it's an excuse not to go to the gym.
There you go.
All right.
No, the more you move, it releases. It's better.
Dr. Sachs, thank you very much for your time and your expertise. We
Thank you,
appreciate
Dr.
it.
Sachs.
Take care.